Dr. Henry, thanks for taking my question. I was hoping that you could elaborate more on the MISC situation, because there are people that are very concerned about what that might have, and I know a lot of people don't know much about it. So could you explain again what the 8 suspected cases mean? As far as, we don't want to alarm people, I think, is just try to explain what impact that has on people in British Columbia if they're worried that their kids might come down with something like this.
I think it's almost exactly the opposite, but thank you for bringing that up. I just, I want people to know that we have been monitoring this. I think early on I reported that we had 6 cases. We've been monitoring this since March, since it was first identified. It's one of the things that is really important for us to see if we're seeing similar things to what's been reported in other parts of the world. And I think it is reassuring that we have had 8 cases that have been reported. They've all been investigated. None of them have been confirmed. So that is also a reflection of the fact that we have low transmission rates in our population, even though we now have several hundred young people who have been affected by COVID. So in this case, we had 8 who have been reported. They've all been admitted to hospital at Children's Hospital. All of them have recovered. A couple of them did require ICU care, and that's what's important about this. It is a disorder that causes widespread inflammation, but there are other causes of it, and I think that's important too, that people know that we're watching for this, we're being careful about it, people are being cared for, and we are testing and making sure and looking for COVID. In the cases that we've had in BC, all of them meet what's called a suspect case definition. And the reason I'm bringing it up today is because we will be reporting it to the Public Health Agency to be part of the global data on this condition and trying to understand it better. But none of the cases here in BC have been related to COVID. So that's important as well. And we'll continue to monitor this really carefully.
For parents and caregivers listening out there, what do the symptoms of MISC look like in children, the ones that you've seen in BC? And you're saying that they haven't tested positive for COVID. And you say there's no incidence of exposure. So why have they become suspect cases?
Yeah, so early on, when this was identified in other communities around the world, we went back, and it was called a Kawasaki-like syndrome. So Kawasaki syndrome is something we've known for quite a long time. We still don't know what causes it. It has been associated with other infections, including gastrointestinal infections like Campylobacter infections and other respiratory infections, but it tends to happen later, so you recover from whatever causes you to be sick, and then you develop this response, inflammatory response. So common symptoms are things like fever, that lasts, a prolonged fever, it lasts for many days, red eyes, skin rash, belly pain, abdominal pain, vomiting or diarrhea, and feeling wiped out and tired, very tired. But it tends to be a constellation of things, and for some children it can spread to causing an inflammation of the blood vessels, and part of that can be a rash or red eyes, but part of it can also affect the blood vessels of the heart. And those are the common things that we see. So prolonged fever after an infection, and any of these other signs that happen, that particularly a child's very lethargic, low energy, they should seek medical assessment for sure, for medical attention. It is, I must say, a rare condition. For all of the children that we've seen around the world that have had COVID, there are still very small numbers of this associated with that. For many other infections that we see, and we've gone back and looked, how many cases of Kawasaki syndrome do we see in BC on an average year, and we've not seen an increase in that. So this is something that happens. It happens caused by other infections and other reasons that we're not entirely sure of. And the reason that we're talking about it now is because we were only reporting confirmed cases, which means you had either a serology test, so antibodies to COVID, you had a positive COVID test because you were sick, or you were exposed to somebody with COVID. And we had no confirmed cases here in BC, but the WHO has broadened the case definition so that we can get a better understanding of the syndrome itself, and the Public Health Agency of Canada and we've agreed in Canada to report these suspected cases as well, so we get a better understanding of the condition. So that's why I'm letting you know now, because we'll be reporting it, and that will be public information over the coming days.
Do you have a follow-up, Mary?
Yes, excuse me, thank you. For the children who ended up in ICU due to MISC or suspected MISC, what was the type of care? Was it for cardiovascular inflammation specifically and around the heart, or did it involve being on a ventilator like people who do have actual COVID?
All of the 8 cases were all hospitalized. 2 were admitted to intensive care. They have all fully recovered, but yes, they were admitted because of concerns around inflammation of the heart and the blood vessels and shock-like syndrome. I don't know if they were ventilated or not, but I do know that all have recovered.